we'll go ahead and get started. Good afternoon, everyone. My name is Alicia Elias. I am here with Stilly Valley Health Connections. I want to thank you for joining us for our Lunch and Learn series with the Washington Poison Center. For everyone joining us live, please note that this class is set up as a Zoom webinar. This means that all participants are muted and your videos are turned off so we can record the presentation. If you would like to leave any questions or comments, we encourage you to do so by using the chat or QA box at the bottom of your screen. Thank you for being here, and thank you to everyone who has joined us so far. Now I will pass it over to Alex, who will be presenting today's topic. Thank you.
Perfect. Thank you, Alicia. And hello, everyone, whether you're here present live right now, whether you're watching the recording in the future. Thank you so much for tuning in today. Well, let's dive right in. Like Alicia said, my name is Alex Sirotzki. I use he, him pronouns. I am a public health educator with the Washington Poison Center. For those who know of the Poison Center, that means that I'm never answering those phones, but I talk about the phones a lot. If you've not heard of us, here is our mission statement right here. So our mission is to prevent and reduce harm from poisoning. And I like showing this because we really do embrace harm reduction and prevention and treatment all in one. Now, when I talk about the Poison Center, I have to talk about poison. So for us, a poison is literally anything, any substance, any product that could be harmful if it's used in the wrong, or if it's used wrong, I should say. So that could mean in the wrong way by the wrong person or in the wrong amount. So when you start thinking about that definition, there are so many products that meet that criteria. Household products, we have plants and cleaners, bites and stings from critters and insects. That also can include medication. Medication, when used correctly, can be incredibly therapeutic. When used incorrectly, can be incredibly harmful. Now, the Poison Helpline, that is really the bread and butter of the Poison Center. I'm going to show that phone number on the next slide. But we're here for you completely free. Call us with any questions or emergencies with potential poisons. So that could mean your kid ate a Tide Pod. That could mean you took the wrong dose of medication or even the wrong medication. That could mean a chemical got on your skin, in your eye, in your ear, anything like that. Give us a call and we'll provide you with treatment advice. You can also call just to ask a question. Say you have a new supplement, you want to make sure it's safe to take with the medication you're on, it's late at night, your pharmacy's closed. Give us a call. We're open 24/7 and totally free. You can call about yourself, you can call about someone else as well. Now, all this lead up to this phone number right here, 800-222-1222. If you have your phone on your person in this moment, please, as I'm going through this spiel, add this phone number to your contacts list. Now, this is a national number, so it's going to route you to your local regional poison center, depending on your area code or where you're calling from. Not a problem if you get another region's poison center, they can always transfer you if they have to. You're going to get the same kind of treatment advice, though. So like I said, we're always open. You can call right now. You can call at 4 in the morning, and someone is going to answer that phone, specifically a very highly trained pharmacist or nurse or physician. They go through just tremendous amounts of training with pharmacology and toxicology, and they're really an excellent group of folks. Like I said earlier, we're completely free. You're never going to get a bill from us. You're never going to get insurance questions from us. We're also confidential. So we're not sharing your information out. Information is safe with us, and it's not our goal to get anyone in trouble. I worry that a lot of folks hesitate to call us because they're worried we're going to contact authorities because they left a chemical like bleach or something out on the counter. Little kid got into it. That's not the way we operate. Our goal, again, is that mission statement is to keep folks safe from potential poisoning. And for anyone who prefers a language other than English, we can bring an interpreter into that phone conversation, also a free service. We contract with our national language line. Now, just a little bit on who calls us. The bulk of our calls, anywhere from 75 to 80% of our calls, depending on the year, come from folks at home or at school or at work, and something just goes wrong. and they call us to see what they should do. But the other 20 to 25% of our calls actually do come from healthcare facilities, from EMTs, first responders arriving on scene to something, first responders who have a patient in their ambulance and they're already on the way to the hospital, emergency department, so on and so forth. Those cases tend to be cases that those professionals have not seen before or aren't as familiar with. And I just bring that up to show that the call takers, the folks who answer our phones, really are the experts that the other experts contact. So you get that same level of expertise when you contact us. Those who are familiar with poison centers may assume we take calls just for kids, and we do get a lot of calls for little kids, especially kiddos under the age of 6, but we take calls for everyone. So it could be kids, teens, adults, older adults. Give us a call if you ever need. And finally, when to call us versus 911 versus 988. We recommend that following a potential poison situation that you call us before 911, providing the person you are calling for is responsive, they can talk to you, they can communicate with you, they're breathing, they're conscious, and they are not having a seizure. We recommend to call us first because there's a very good chance we can keep you home. We keep about 90% of folks who call us first at home. We will, of course, say, oh, you really need to get to the hospital or call 911 if we believe that to be the case. But of course, if the person you're calling for is unresponsive, unconscious, not breathing, or they are having a seizure, of course, call 911 first. And then that reminder that 988 is there for any mental health crises. All right, folks, now hit me up with questions as you have them. I've got the chat box open. I've got the Q&A box open. If you have any questions on Poison Center services, send them my way anytime. I'll do my best to answer as they come. But let us pivot and talk about cannabis. So this plant and substance has so many different names. It is really a fascinating Google search to punch in terms for cannabis. You'll see many, 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 many different slang terms. Cannabis and marijuana and pot and weed and so many variations. Now, all of these terms have different histories, different levels of stigma attached to them. You're going to primarily hear me use the term cannabis today. I may occasionally say marijuana as well, depending on the slide, depending on the context. So just keep that in mind. Now, cannabis sativa, this is a term for the plant that it all comes from. There is a ton of variation in this plant. Some forms of it of course, become drugs, become various forms of drugs, and other forms of it are not used for drugs at all. A lot of forms of cannabis can be used to make food and textiles and soaps and all sorts of different things. So huge variety within this one category of plant. Now, you're going to hear me use the term THC a number of times this afternoon. When I say THC, unless I qualify otherwise, I am referring to delta 9 tetrahydrocannabinol. That is the main regulated and the main intoxicating component of the cannabis plant. It is not the only intoxicating component, but it's the one we know the most about, and it's typically the most potent of those intoxicating components. Um, Federal legality around THC is in a state of flux right now. Historically, from 1971 until last year, it has been, and still into this year, it has been a Schedule 1 substance. So Schedule 1 substances are defined as substances with no currently accepted medical use and a high potential for abuse. Now, I don't love this term abuse when talking about substances and drugs, but in this context, that means a high potential for problematic use, for addiction, and so on and so forth. We'll talk more about what a Schedule 3 substance means a bit later on in today's presentation. Um, Hemp is a version of this plant with less than 0.3% THC. It used to be fully illegal. It became federally legal in 2019. Now, folks may have heard of medical cannabis or medical marijuana. Washington is a medical cannabis state in addition to having retail legality as well. So if a state has retail legality, that means anyone over the age of 21 may purchase up to a certain amount of cannabis products for their own use. Medical systems are a little different. The medical cannabis systems basically mean that in there's a big range depending on what state laws we're talking about, but basically mean that if you have a certain type of medical condition and you do all these other things, you might qualify to access cannabis to help alleviate symptoms from that condition. This list you're seeing right here, this is Washington's medical cannabis system. These are the qualifying conditions that could allow someone access into that system. I won't read it all out here, but this is on the Department of Health website, worth checking out if you're curious. There are some considerations with all of this. Typically, it's not enough just to say, "Oh, I have glaucoma, I should get cannabis." A lot of the times, folks need to go through and have pretty intensive documentation from their medical provider showing that they tried what's called the medical standard of care for that particular condition, which means they tried what is medically recommended at the time, whatever treatment is recommended at the time, and they have to document that it didn't work. Um, Now, not all of these conditions have robust evidence to show that cannabis may alleviate symptoms from them. That is kind of a growing body of knowledge as we learn more about long-term effects and short-term effects of various forms of cannabis. But I just wanted to acknowledge that Washington does have this medical infrastructure as well around cannabis. Now, cannabis, retail cannabis, excuse me, was legalized in Washington in 2012. The first stores under that system opened up in 2014. This was passed with Initiative 502. The current setup with it is that folks have to be 21 years of age to purchase, possess, or use cannabis, and they can only legally purchase cannabis from licensed retailers. Uh, um, uh, the law has changed a little bit. It used to be that some folks could purchase products with less than 0.3% THC outside of licensed retailers, but that law changed a few years back, and any measurable amount of THC in a given product has to be purchased through these retailers. Now, even with that legality in Washington, it is still illegal to use cannabis products in public. It is still illegal to drive under the influence of cannabis. Washington's one of the few states where it's illegal to grow cannabis plants at home unless someone has that medical cannabis access. It is still illegal to take legally purchased cannabis across state and tribal lines within Washington and state lines across Washington. So, for example, Oregon has somewhat similar laws with cannabis as Washington does. It is technically illegal to take Oregon cannabis into Washington or Washington cannabis into Oregon. It is also illegal to use on federally operated and funded lands, waters, and property within the state of Washington. All right, I'm almost done with the legality side of things. I mentioned cannabis going through this state of transition into a Schedule 3 substance. So, Schedule 3, I'll just read this verbatim. Schedule 3 drugs, substances, or chemicals are defined as drugs with a moderate to low potential for physical and psychological dependence. So this is definitely an interesting shift. This recommendation started in 2024 at the national level. The Department of Justice submitted a proposal to that effect. In December of 2025, an executive order went through to begin the process of rescheduling. Just a couple months ago in April, it looks like FDA approved cannabis products and local, state medical cannabis products are now considered Schedule 3. And later this month, there's an executive administrative hearing that will start to consider broader rescheduling efforts. So it seems like things are underway to, at the national level, reschedule cannabis. This does not mean that if this full rescheduling takes place, it does not mean that cannabis is suddenly legal, suddenly nationally legal. It does mean that it is, among other things, that it is likely easier to research the health effects of cannabis. Okay, now that I've blasted you all with a bunch of the legal side of cannabis, let's talk a little bit about what it's doing in the brain and body. So, let's start with what's called the endocannabinoid system. So this is what we call a neuromodulatory system in the human brain and human body. That means we have a bunch of receptors that can respond to cannabinoids, these components within cannabis, throughout our brain, throughout our body. And neuromodulatory means it helps uh, interact with and regulate other body systems. Now, we're still learning more and more and more about this system all the time. It intersects with a whole lot of things, seems to help with, or at least it seems to influence how we deal with stress, how we cope with stress, our impulse control, and behaviors around coping with stress, how we form and store memory, our sense of reward, so on and so forth. Now, there are a bunch of these cannabinoids that are found in our bodies already, so you can go your entire life without ever using cannabis. You have this system in you, and you have these cannabinoids that your brain and body are producing and responding to. There are also these external plant-derived cannabinoids, phytocannabinoids, and we see most of them coming from the cannabis plant. There are well over 100 known cannabinoids out there. We're going to mainly talk about THC, or Delta 9 THC. So, something poison centers and clinicians like to keep in mind is that how something gets into the body, pardon me, has a can have a big effect on the effects it has in the body. So THC generally gets into the body through three ways: through inhalation, that's breathing it in; ingestion, that's eating or drinking it; and absorption, that's where it passes through different membranes on or in the body. Sometimes the skin, but what it seems like we see more of is through membranes in the mouth. Now, this is just kind of a hodgepodge compilation of some of the symptoms we see at the Poison Center. I was looking at some of our more recent cannabis case data and was just going through and tallying some of the different clinical symptoms we see, or that folks report to us in the cases we receive. And a lot of central nervous system depression. So that could mean a lot of things. That could mean someone's very, very sleepy. That could mean someone's fully unconscious and you can't wake them up. There's a big, big range there. We can see agitation. This can happen more. It seems to happen more with higher doses of THC. And very much depends on the individual and their potential use history, so on and so forth. Tachycardia means elevated heart rate. We can, like I mentioned earlier, we can see sleepiness and lethargy. We can definitely see impaired attention. Folks can have difficulty concentrating, difficulty forming and storing new memories, having a hard time estimating how much time has passed. In more extreme cases, we can see panic attacks. We can see folks experience very acute anxiety, paranoia even, and on occasion, we have reports of hallucinations and delusions. We can absolutely see decreased motor coordination, hypertension, that's elevated blood pressure, issues in the GI tract, so nausea and vomiting, dilated pupils. Now, pharmacokinetics, this is a fancy way of saying how drugs move through the body. Now, THC loves fatty tissue, so that means it's highly lipophilic. So it hangs out in adipose tissue in the body. It can hang out in the liver, in the lungs, in the spleen. And typically, major effects start to kick in. or start to last, excuse me, 4 to 6 hours after it hits the bloodstream. Now, THC is metabolized by the liver, so you break down quite a bit of it. A lot of it comes out in the feces and in the urine. It is worth noting THC and another cannabinoid, CBD, that's cannabidiol or cannabidiol. Um, Markers of those cannabinoids can hang out in the body. For quite a while because it likes fatty tissue. It holds on for a while. So it can take a while for all of those to sort of filter out of the body. So for folks who use very, very, very heavily, very, very frequently, and they stop, they may actually have these cannabinoid markers in their system for up to 3 months, depending. So a lot of folks who are needing to take a substance test, a drug test, may fail that test if they had used cannabis very heavily, even if they quit, a few weeks back, depending on if what that test is looking for. All right, so I mentioned a little bit of how cannabis gets into the body through inhalation, ingestion, and absorption, but we're going to talk about all of those in a little more detail. Now, like I said, inhalation is simply breathing in particulate matter. That could be smoke, that could be vapor or aerosol. The common methods we see here are smoking and vaping. So smoking is, lighting the plant on fire and breathing in that smoke, in various forms. Vaping is inhaling an aerosol that is released from heated plant material. The mechanism behind vaping is to heat something up enough that it starts to release those oil particles, but not so much that it combusts or bursts into flame. Inhalation, whether it is smoking or vaping, is a pretty rapid delivery method to the bloodstream and the brain. So folks start to feel effects within seconds or minutes of inhalation. And the different forms of cannabis we see are dry flower and cannabis, excuse me, and concentrates, for inhalation. Now, just to show some examples of different labels here and to talk a little bit of how this is all measured out. So the units of measurement on this is all dry flour, is generally weight and then the percentage of cannabinoids here. So a lot of the times the weight will be listed in grams, sometimes ounces, depending on the product. And then it'll break down, okay, with THC, we see this much percentage. With CBD, we see this much percentage. And here's another image here, just showing this is an older picture now of a concentrated product, so a 1 gram concentrated product, and you can see in the potency analysis, you see all these different cannabinoids listed here. Now, I want to point out, I've talked a lot about Delta 9 THC. There are all these other versions of THC, that I think it's worth acknowledging. I'm just going to talk about one more for a moment, though. This is THCA. This is tetrahydrocannabinolic acid. So this is what we call a precursor to THC. And when you heat up THCA, a good chunk of it will become THC. So if someone was looking at this label and saw, wow, only 0.58% THC, this won't get me high at all. It's really important to look at that 28.93% THCA and ultimately looking at that total THC percentage there. There's some kind of behind the scenes math that a lot of the manufacturers of these products do to give you a loose sense of how much THC would actually like make its way into the body once this is heated up. I just want to clarify that while we're on this slide. Now, a little bit on vaping versus dabbing. I haven't mentioned dabbing yet, but a lot of folks have at least heard of this term, and I like to distinguish what these terms actually mean. So, vaping uses a convective heat or an indirect form of heat where the device heats up the air, which the air in turn heats up the product or the substance. There's, it's a less efficient heat transfer in that sense, so it takes more power, it takes a little longer. Um, and it is arguably it releases fewer carcinogens compared to dabbing, which uses conductive heat. We see vaping devices used for nicotine and cannabis products. There are other substances that are, I don't know if this is a word, but vapable as well, but we don't see that nearly as commonly as nicotine and cannabis. Now, dabbing, like I said, uses a conductive type of heat that is a direct form of heat transfer. So basically, you heat up a surface, you add the cannabis product to that surface, and it immediately heats up that product. It can release far more chemicals, far more carcinogens. Often these are superheated products, so there sometimes is some combustion that occurs. And this seems to be mainly used for cannabis products, not nicotine products. So, like I said, you get a high heat, a level of heat involved. A range we've come across in the literature is 750 to 900 degrees Fahrenheit. Dabbing uses concentrated products, so it's already going to be a very high or a higher THC concentration, but then it is superheated and released very quickly. So it is a very rapid onset of effects. So there's pretty great potential for having a much higher dose than intended. And because such high heat is involved, there is, of course, the potential for burns. Now, I mentioned dried flower in concentrates earlier, just some imagery to show that. Dried flower generally has a range of anywhere from 5-ish% THC up to around 30% THC. Looking at Washington data on our average sold, like legally sold dry flower products have around 20% THC. For folks who maybe wondering how how cannabis flower has changed over the decades. In the 60s and 70s, average THC could be anywhere from like 2 to 3% for dried flower. And when you have most products sold in Washington at 15, 20, or even more percent THC, this is a fundamentally different product than existed all those decades ago. So much higher potency. And then concentrates, as the name implies, are significantly more concentrated than the dry flower products out there. Big range, 35%, sometimes upwards of 90% THC. A lot of different forms here. Some of them are solid concentrates, some of them are liquid concentrates, and kind of everything in between. Now, a bit on ingestion. So, eating or drinking cannabis products or cannabinoid containing products. The most common form here is edibles, but we do have legally sold cannabis beverages in the state of Washington. Um, th- if someone ingested dry flower on its own, it's never been heated up or anything like that, they may not have an intoxication effect. There's some interesting science that goes into um, what converts those cannabinoids into an ingestible form that can bring on that psychoactivity. One thing to note with cannabis edibles and beverages, one of the biggest differences with other methods is how long it takes to kick in, so to speak. So it can take 2 to 4 hours, sometimes even longer, from the time of ingestion before it goes through metabolism, the digestive process, and actually hits the bloodstream. This has been a problem in a number of states, Washington as well, when they first introduced their uh, cannabis law, like retail cannabis laws, especially if things aren't very well labeled or if the package is misleading at all. There would be a number of folks who would either eat the entire package, not realizing that that would be 10 or more recommended servings of cannabis, but they may also not realize that an edible is supposed to, or that it takes a while to kick in. So there were a number of calls to the poison centers early on in legality, and this still happens sometimes, where someone will take an edible. they'll wait 3 hours, not feel anything, and then they'll take another edible or even more edibles. And then that's all just in the system and can be a much more intense and often unpleasant, sometimes medically scary situation than they were going for. Something to note with edibles, this not for kids label legally has to be on all edibles and cannabis beverages. You may realize from when you put it in your phones earlier that that emergency number listed under there is the poison helpline. So this is a reminder to adults in the home that these products are not for children and they really should be stored safely up high, out of reach, locked up as well. A little bit on labeling here. So a lot of the times it's showing the weight of THC and CBD and other cannabinoids in the product. So doozy is this particular form of edible. Each doozy, each serving contains 10 milligrams THC, 2 milligrams CBD. This cannabis beverage is very CBD heavy, so the whole bottle has 30 milligrams CBD, 3 milligrams of THC. All right, on our last way into the body here is absorption. Like I said, that's application or transfer of things through membranes on or in the body. One common route is tinctures. We don't have tons of case data for tinctures to the poison center, but it does happen. These are typically oils, cannabinoid-containing oils, often placed under the tongue with a dropper. They typically absorb through the membranes under the tongue by the gums. Folks can ingest them, but then it acts more like an edible. The range of when these take effect can be pretty big, 15 minutes to over an hour, just depending. And then topicals, these are lotions, ointments, balms that contain various cannabinoids. They're typically not intoxicating on their own. There are some exceptions, though, one of the biggest being transdermal patches. Onset of effects, again, can really vary. I want to acknowledge that there is a risk of substance interaction between cannabis and different cannabinoids, as well as other substances, including medications. Now, keep in mind, THC and CBD are metabolized and broken down by the liver. Um, and what can happen is if the liver is occupied with breaking down THC, it can back up or delay how long it takes for the liver to break down medications you need to be taking. And sometimes it can build up more in the body. It can cause longer lasting effects, stronger effects, and so on and so forth. Now, I listed Epidiolex as a medication here. Epidiolex is a CBD derived medication. Was FDA approved a number of years ago for specific forms of epilepsy. And one of the big side effects listed is possible liver damage. So something to pay attention to. Now, this is kind of a growing field of research here on this idea of cannabinoids interacting with other medication or with medications and other substances. Um, this is not a list of every possible medication out there, but some of the themes researchers have come across is that if a medication causes drowsiness, cannabinoids, specifically THC, but CBD as well, can increase that drowsiness. If a medication has a risk of bleeding, cannabis can increase that risk of bleeding. And finally, if a medication has an effect on the blood sugar, cannabis can increase that effect on the blood sugar. So I put this on folks' radar. Again, we're in a state that has medical laws surrounding cannabis. It is important for folks who use cannabis for any reason to make sure that their doctors, their care teams are in the know about that, so there can be any discussion about potential interactions and concerns there. Now, I would be remiss if I did not acknowledge that cannabis, the way it is intoxicating, the way it is impairing, can absolutely impair driving. Um, and this effect is even stronger for those who don't use cannabis as much because they have a lower tolerance for THC. Um, I also want to note that combining cannabis and alcohol together leads to a greater level of impairment and increased risk of crashing a vehicle compared to using either substance alone. I bring this up because a number of years ago, in the late 2010s, there was an odd trend of Washington drivers who reported that they used cannabis to sober up from alcohol. And that is not how the brain and body works. Cannabis cannot sober someone up from another substance. As a general rule, the more substances someone uses at the same time, the less likely they are able to gauge their own sobriety. So a lot of those drivers may have truly felt sober when they actually were more impaired, were more intoxicated than they were prior. So please, if for anyone who may be using cannabis, especially when combined with alcohol, don't drive after, make alternate plans. All right, a little bit on cannabis dependence. So I like to bring this up too because I grew up with a lot of rhetoric, especially when I was in college, a lot of rhetoric around, oh, cannabis is not addictive. Anything psychologically addictive, but it's not physically addictive. And a lot of the research challenges that idea. Folks report, especially folks who use cannabis products regularly, that they build a tolerance to THC pretty quickly. And a lot of folks who quit using cannabis or severely reduce their use of cannabis, especially after using heavily, definitely report experiencing withdrawal symptoms. And anytime withdrawal symptoms show up, that is your brain and body kind of freaking out, wanting this external substance that it grew to expect, that it became used to. And it's trying to reach homeostasis again, or that balance or equilibrium again. Now, typically, when someone uses cannabis regularly and then quits or stops, withdrawal symptoms can emerge, 1 to 3 days after quitting or abstaining, may peak between days 2 and 6, may last up to a couple weeks. But remember what we talked about earlier with cannabis loving fatty tissue. So for folks who use really heavily, those effects may be delayed because those markers in the body are kind of tricking the brain into thinking there's still cannabis present. I want to clarify, if someone uses very heavily and then fully quits, that does not mean that they're just high for 3 straight months as those markers are filtering from their body, but it does mean that those markers are still present. Here are just some common withdrawal symptoms we've come across. A lot of sleep disruption. And it's worth noting a lot of folks report seeking out cannabis to help with sleep disruption and sleep disturbance. So you can fall into a bit of a feedback loop there. Folks may deal with anxiety or irritability, bouts of depression, difficulty concentrating, and things like that. Now, I also want to acknowledge a growing link that researchers have been noting for a number of years now. There's been some newer research that really elevated the concern with this. Let's talk a little bit about schizophrenia and psychosis. And I first want to distinguish there's a difference between a chronic diagnosed psychotic disorder, such as schizophrenia, and an acute short-term bout of psychosis or psychosis-related symptoms. These are different things. Someone can experience a bout of psychosis and not have a diagnosed psychotic disorder. Um, and newer research is showing that there are a couple things. One, there is a correlation between using cannabis and developing a psychotic disorder. There is also a correlation between using high dose cannabis and potentially experiencing an acute bout of psychosis. And some of this new research is showing that those acute bouts of psychosis, when they come from using cannabis, can increase the likelihood of developing that diagnosed psychotic disorder. It can bring on those symptoms potentially faster. Some of the risk factors, like I said, are higher doses of THC. And remember, high THC in the 60s and 70s, THC levels were much, much, much lower. Um, a lot of this research defines high dose THC as cannabis with at least 10% THC. And remember, most legally sold flower in the state of Washington is well over 10% THC. You can see that on this graph here. This was 2020 data on that graph. Frequent use of cannabis, especially daily use of cannabis, is also a risk factor. And then starting cannabis use at a young age is another risk factor. And that reminder, our legal system with cannabis in Washington is based around age 21. Human brains continue development sometimes up to and even past age 25. All right, I'm going to pause just for a second to hydrate myself. Hit me with questions if you have them. We're getting close to the end here. I'm just going to wrap things up with a discussion of some Poison Center data. Couple caveats to keep in mind for Poison Center data. No one's required to call us, so anything I share about trends, our case data is going to show an underrepresentation of the number of exposures or a given substance with a given age group. Changes in our data can happen for a lot of reasons. It may be the change of awareness of a product, change of awareness of the Poison Center, change of awareness or accessibility to a product, response to societal changes, large-scale traumas. We saw a big change in our calls in a lot of products during COVID. Folks were dealing with isolation. We dealt with we had a lot more cases of cleaner exposures to different cleaning products. We don't track repeats. So repeat callers, we're not tracking that. So if I had a cannabis issue on a Monday and called the Poison Center, and then I had a different cannabis issue on a Thursday and called the Poison Center, the Poison Center's not saying, it's Alex calling again. It's going to generate a new chart. And then folks call us for short-term issues. Folks call us, and our treatment is for acute cases or acute exposures. Acute meaning short-term, chronic meaning long-term. Now, kind of another way of framing some of that, but in a maybe more humorous way. Folks call us when something's gone wrong in the short term. So they made a mistake, they're concerned, they're scared, something bad has happened. They're not calling us because they loved their drug experience. They're not calling us to say, wow, this strain of cannabis is the best ever. That's really not happening with our case data. So keep in mind, our data tells some more specific stuff. So this chart here, this is showing all cannabis cases reported to the Washington Poison Center from the year 2000 through last year, through 2025. And you kind of see an interesting trend here. We got an uptick in 2011, a bit of a decrease, another uptick in 2014, and then by and large, a pretty steady increase all the way up to 2022. And in since, we've had a somewhat steady decrease in the number of cannabis cases reported to us. Now, looking by age group, this is comparing 2024 and 2025. Again, we had that slight decrease there. Um, Let's see. We have most of our cases, but certainly not all, are concentrated in little kids. And what this tells me for these kinds of cases is that this is a lack of safe storage in the home. So these are products likely being left out. Or even if they are put away, kids who are very curious and good at climbing, good at getting into things, and are seeking, trying to see what that product is. When a 3-year-old gets into a product, we're not coding that as that 3-year-old's trying to get high. We're coding that as like that kid wants what they think is a piece of candy. They're curious and are exploring. But we do get a number of calls in these other age groups as well. When we look at types of products, you can see about half of our calls are for edibles. 2024 is that blue bar, 2025 is that green bar. That decreased a little bit from 2024 to 2025, but the ratio is still pretty similar. About half of our calls are for edibles. Remember, there is that not for kids logo on that edibles label. Um, around 20% depending on the year of our cases involve dry flower. 14 to 17% depending on the year on concentrates, and then we have that other category as well. Is psychosis more prevalent with ages under 25 with cannabis use? That was one of the risk factors for eventually developing a diagnosed psychotic disorder. Acute bouts of psychosis, I'm not positive. I think it depends on if we're looking at individual risk factors versus like population level risk factors. I would wager there are more total cases of acute psychosis with adults. Instead of kids simply because there's more overall use happening. Again, not everyone is required to call the poison center if something goes awry, but yeah, that would be my assumption there. Good question. When we look at it, cannabis exposures by reason, unintentional general just means it was an accident. Like I said, a 3-year-old's not trying to get high. They're just curious about that piece of candy or what they think is that piece of candy. Intentional abuse. Now, I want to acknowledge abuse is a stigmatizing term in this context when we're talking about substance use, drug use. Abuse can be quite stigmatizing. I show it as is, though, because that is still tied to poison center coding. So, from poison center perspective, intentional abuse means that individual was seeking some form of psychoactive experience or some form of impairment or intoxication. Um, Misuse is kind of a strange category, but it basically means someone used a product wrong. They thought they were supposed to drink the concentrated product rather than inhale it, something along those lines. And then we do get a number of what we call therapeutic error calls or cases, and those are medication errors. All right. No, this was actually kind of exciting. This is the newest addition to this training because there was a very recent National Poison Center cannabis study. It reviewed a lot of cannabis data at the national level, and it compared cases of cannabis to other drug cases. So it had these two groups of one was licit or legal substances, and the other was illicit or illegal substances. Um, so you can see those different substances listed out there. And these are just some of the results. It's worth checking out this study if you're curious about it. I have the citation down at the very, very bottom there. There and I forgot to put this in here. Apologies, folks. This looked at data from I believe 2013 to 2021, so it was a good chunk of time. Um, there has been an increase in frequency of harms associated with marijuana or cannabis reported to poison centers. Generally, we see less severe outcomes with these cannabis related harms compared to these other drugs that they looked at. And cannabis or marijuana cases primarily involved kids under the age of 6, 70% across all of these years across the whole country, and primarily involved edibles. The big recommendation from this paper, the main one they listed in their conclusion, was that the data suggested the need for safe storage and public education for marijuana or cannabis poisoning prevention, particularly in children and adolescents. Now, I wanted to end with just a couple slides on safe storage or safer storage. A couple things I want to keep in mind here. When we use the term safe storage on its own, it kind of breaks things down as something is either fully safe or fully unsafe into this almost this dichotomy. Safer storage may be a slightly better framing, that this may not be a perfect way to store this, but it's at least safer than this other way of storing this. So the mechanism of safe storage or safer storage is really anything that increases the amount of time it takes for someone to access a product, especially someone who shouldn't be accessing that product. The more time available means there is more opportunity for someone else to intervene, regardless of the reason for use. That could be a curious kid, that could be a teen or an adult or an older adult in a state of crisis, and unfortunately engaging in self-harm. That could be a number of reasons there. Some other things to keep in mind with this idea of safe or safer storage is that child resistant is not child proof. If something was truly child proof, it's adult proof. Child resistant, again, just adds time before someone can get into something. And kids are smart and kids are always growing. So a strategy that works 1 month may no longer work the next month as that kid grows and develops and learns to climb and learns to get into things more. And finally, safer storage applies to all products. That could be chemicals and cleaners, medications, supplements, vitamins, prescription medications, over-the-counter medications, substances, whether they are legal or illegal. Safer storage reduces the risk that someone who shouldn't get into that product will get into that product. And a couple reminders here for safe storage to really work, it kind of has to be adaptable. Like I said, storing something up high and out of reach may only work for so long if a child in a home learns to climb up on the counter, learns to climb up on top of the fridge, and to get into cupboards. So layering different levels of safe storage can be helpful. Doing something is better than doing nothing, and there is always a balancing act between allowing accessibility to those who need a product and reducing accessibility to those who don't need a product. And what I mean by that, if someone needs to use a pill organizer to keep track of when they've kept medications, for example, storing that is helpful to have that pill organizer. Those pill organizers are often not child resistant. So it's still important to store that pill organizer out of reach or out of sight of a child. So all these considerations, and here's just a basic list of some things to keep in mind with storing products safer. Storing in original containers. This is really helpful. It helps reduce mix-ups of products. Now I'm showing juice and cleaner here, but in this presentation we've talked about cannabis beverages. So making sure that those are very well labeled, not poured into something else. Further labeling products. That could be a Mr. Yuck sticker. We're big fans of Mr. Yuck at the Washington Poison Center. That could be other forms of labeling as well to help differentiate between the potentially more toxic or poisonous substances and their safer lookalikes. Storing products, like I said earlier, up high, out of sight, out of reach can be very helpful if there are little kiddos in the home. Locking products up, this is another way to buy time, whether that's a lockbox, whether that's a safe, whatever that might be, but adding that additional barrier can be helpful. And we don't always talk about this, but education is also, in my mind, a form of safer storage. Adding a Mr. Yuck sticker as a form of labeling something, but then not doing anything else with it, all you're doing then is you're adding a fun cartoon character to a potentially dangerous product that could arguably be more appealing for a kiddo in the home. So you have to follow that up with Mr. Yuck means don't touch without an adult there. Mr. Yuck means it could make you sick. That product could make you sick. And so that education is really key. And then disposing of unneeded and expired products, whether that is medications, whether that is cleaners or other chemicals. It is hard for someone to have an overdose situation on a product that is not there. So I know that was a ton of information to process, everyone, but that brings us to the end of the slide deck today. I'm happy to hang out for a few more minutes to answer any questions that have come up. And thank you all so much for being here. This is my direct email address if folks have questions about the materials. But if there's a poison emergency, don't email me. Please call the poison helpline. Thanks, everyone.
Thank you to everyone who joined us for this class. If you're interested in joining us next month with the Washington Poison Center, the Lunch and Learn session will focus on Kratom 7OH, health considerations, and current trends. Kratom 7OH, a closer look at a growing concern, will be on Wednesday, July 8th from 12 o'clock to 1 p.m. You can find registration on the Stilly Valley Health Connections website. As you are leaving today's webinar, there will be a quick 6-question survey that will appear on your screen. We would love it if you could take a minute to let us know what you thought of the class and to share any feedback or suggestions for future classes. Thank you all for being here today, and I hope to see you in the future.